Well, thank you everyone for joining us today. This is our fourth educational session of the series that we've hosted this past year. Today's session is on housing resources. And before we get started, just quick run through of today's agenda. We will have introductions, and then we'll discuss more about homelessness. We have a speaker today discussing SOAR, and we'll be discussing more Kansas housing resources. So for introductions, if you go ahead and in the chat box, if you could put in your name, what county you're in, and your role with AOT, and if you're not involved with AOT, what your role is in general with your job. And introducing today myself, Isam Moya, as a AOT project director with NAMI. Then we have our AOT specialist in our different pilot sites. We have Kathy, Amy, and Chris. Gina couldn't be here with us today. And then we have Isaac Johnson. He is a NAMI Kansas resource line director. And he's the one that will be presenting later on in today's discussion. So the first subject we'll be discussing today is just homelessness in general. Let's talk homelessness. And this is a topic that is vastly discussed throughout not just the mental health field, but also the legal system and in the healthcare system and in general in Kansas. But what is homelessness? Homelessness or houselessness, is also known as a state of being unhoused or unsheltered. This is a condition of lacking stable, safe, and functioning housing. And homelessness is defined with 4 different categories. The first one, category 1, is literally homeless. This is when an individual or family who lacks a fixed, regular, and adequate nighttime residence. This means that has a primary nighttime residence that is a public or private place not meant for human habitation. Also, is living in a publicly or privately operated shelter designated to provide temporary living arrangements, such as shelters, transitional housing, hotels, paid motels by charitable organizations or by federal, state, and local government programs, or is exiting an institution where they resided for 90 days or less and who resided in an emergency shelter or place not meant for human habitation immediately before entering that institution. And also with category 1, it's important to note that an individual or a family only needs to meet one of these 3 subcategories to qualify as a homeless category 1. And category 2 is that of immediate risk of homelessness. An individual or family who will immediately lose their primary residence, provided that number 1, residents will be lost within 14 days of the date of application for homeless assistance. Number 2, no subsequent residence has been identified. And number 3, the individual or family lacks the resources or support networks needed to obtain other permanent housing. And it's important to note that individuals and families who are within 14 days of losing their housing, including housing that they rent, own, or are sharing with others. And this is if they're or if they're living here without rent as well, which includes couch surfing, is sometimes what that is referred to as. Category 3 is homeless under federal statutes. This is an unaccompanied youth under 25 years of age or families with category 3 children and youth who do not receive otherwise qualify as homeless under this definition, but who are defined as homeless under the other listed federal statutes. 2, have not had a lease, ownership, interest in permanent housing during the last 60 days prior to the homeless assistance application. 3, have experienced persistent inability as measured by 2 moves or more during this in the preceding 60 days. And 4, can be expected to continue in such status for an extended period of time due to special needs or barriers. And it's important to note that with Category 3, HUD has not authorized any continuum of care to serve the homeless under this Category 3, which means that individuals or families that qualify as homeless and under Category 3 can be served by the ESG program, and later on we'll be discussing ESG more. And if this is if they meet the requirements needed for that. In Category 4, this is fleeing or attempting to flee domestic violence. This is number 1, any individual or family who is fleeing or is attempting to flee domestic violence, has no other residence, and lacks the resources or support networks to obtain the other permanent housing. And it's important to note with this that domestic violence includes dating violence, sexual assault, stalking, and other dangerous or life-threatening conditions that relate to violence against an individual or a family as a whole. And when keeping in mind these different categories of homelessness, it's important to note that homelessness in the United States, on a single night, we see 553,742 people are experiencing homelessness. And this number has changed. This information is taken from the U.S. Department of Housing and Urban Development report that they published in 2017. So post-COVID, we have seen an increase in homelessness in the United States. And this means that for every 10,000 people in the country, 17 were experiencing homelessness, and approximately 65% were staying in an emergency shelter or transitional housing programs, and about 35% were in unsheltered locations. So that's always important to keep in mind when thinking about the houseless population. And homelessness in Kansas. And this is a number that we definitely see change all the time. This information was taken from the Kansas Housing Resources Corporation, and with their information that they have, it's that is an estimated of 2,209 individuals in Kansas experience homelessness every single day. In breaking down that information, this means we see approximately 209 family households experience homelessness, 161 veterans, 339 experience chronic homelessness, and 120 unaccompanied young adults and children ranging from the ages of 0 to 24 experience this. And it's important to keep in mind that post-COVID, we have seen the increase in numbers, but this is the information that the Kansas Housing Resources Corporation had to offer. And when thinking and discussing about homelessness, we also often see that relationship between the criminal justice system and housing. And I know this is something that we see not just with AOT, but other criminal justice related activities and as well as mental health related activities. So with that, often we see a revolving door of the revolving door in homelessness, and those that are participate in AOT or actively in AOT teams in their counties, we are a little bit more knowledgeable about the revolving door in our areas. That includes that incarceration, that homelessness, that going into mental health hospitals. And prior to COVID, we saw 500,000 people entering shelters directly from when they got out of prison or jail each year. And this is what we normally see. We see people that exit the justice system and go directly into being homeless. Formerly incarcerated people are 10 times more likely to be homeless than the general public. And this information was taken from the Prison Policy Initiative, a report that they ran. We often see that people returning from jail or prison, they face barriers to finding stable housing and employment due to legal restrictions and discrimination. And we see this discrimination in many different settings. People incarcerated more than once have a 13-time higher rate than the general public. So normally what we see is when a person, their first time being incarcerated, they have 10 times more likely to be homeless than the general public. But if they've been incarcerated more than once, that's where we see that increase of they're 13 times more likely to be homeless and have that difficulty finding a place to live. And this is often, again, caused because of that discrimination that we do see. And another thing to consider with homelessness is also that of being housing insecure or housing insecurity. And this is very common among formerly incarcerated people. So what the numbers that we see is housing insecurity is typically broken down into that of the person that is homeless, such as they're living in they don't have a shelter. They might be living under a bridge, in a park, as we often see. We have those that are sheltered homeless, which they're living in a shelter. They might be living with a friend. They might be living with so a family member and such. And then we have marginal housing, which is someone that is living in a hotel, or a motel, and they have to pay by night to be able to be housed. And out of this, we see that, so altogether, we see that 570 people out of every 10,000 formerly incarcerated or housing insecure, compared to that of the general public. And as with that broken down, we see about 105 of those 10,000 individuals are uh, homeless, completely unsheltered, and 98 of those are typically have that sheltered housing, and 367 of those have that marginal housing, which that again, that insecurity of not knowing if they're able to pay the next room in the hotel room, or if they're have to find some different place to stay. And again, with this information, this is a report that was done prior to COVID, and after COVID, we've seen increase in situations like this. Um, and often with this housing insecurity, we see barriers such as screening criteria that might include, like, for example, checking criminal records, checking credit checks, having high security deposits, and requiring professional references. So oftentimes someone that is formerly incarcerated coming out of that criminal justice system, it's difficult for them to have access to this information, and it's difficult for them to have a decent credit check that might help them find better housing, or they don't have the funds to pay for that security deposit. And this is what typically keeps that population in this range of being housing insecure. And with housing insecurity, we often see the causes of this is that just discrimination of this is done by public housing authorities. Sometimes we see private property owners and also affordable housing shortages. So what we often see is many landlords, they don't feel comfortable renting out to someone that was previously incarcerated. Again, facing that discrimination of not being able to find housing because people might not feel comfortable with this. And with that direct discrimination that they might be facing, the consequences is that a person being homeless or housing insecure, it really does reduce their access to healthcare services. This includes uh, primary care, this includes addiction, recovery, and also mental health treatment. So typically a person that is housing insecure, a person that is homeless, their health and those healthcare services are not primarily on their mind. They have other things to worry about, such as being able to find housing or worrying where they will be sleeping that night. It also this makes it difficult to find a job and secure a job because they don't have that address. They might not have documents available if they are just in that transitional housing. And this also prevents formerly incarcerated people from accessing educational programs. And this could be community educational programs. This could be going back to school for some sort of degree. We often see that this population that is housing insecure, they have more difficulties than just not knowing where they're going to sleep that night. It really is a spectrum of different issues that leads up to providing more anxiety and more worries in their life. And with that of the criminal justice system, we also have to keep in mind homelessness and mental health, which they do coincide with each other. And as we've seen, those that are participating in the AOT programs, and they're involved, they're part of that treatment team, you often see that correlation of a person that's coming directly out of the criminal justice system or is involved with the system and mental health. So what we see with homelessness and mental health is that according to SAMHSA, we see 26.2% of all sheltered persons who were homeless had a severe mental illness. So again, that shelter person is still someone that is housing insecure. And we have 34.7% of all sheltered adults who were homeless had chronic substance use issues. And again, that also correlates with their mental illness and their current struggles with being housing insecure or homeless. And we have those who experience chronic or long-term homelessness. Approximately 30% of those have mental health conditions, and 50% of those individuals have a occurring of a mental health condition with with some sort of substance use problem. And often what we see in this population is that of common mental illnesses are depression, bipolar disorder, schizophrenia, anxiety disorders, and substance use disorders. And with what we primarily see with AOT participants, these are participants that often have such diagnoses as these and often do face um, that discrimination or that issue of homelessness or housing insecurities. And this is commonly seen all throughout. And this is what makes it makes it challenging to access care. So we have, whenever a person is housing insecure, we often see that they face issues when it comes to transportation. So many homeless individuals that lack adequate transportation sometimes are unable to take care of the necessary tasks involving getting care. And this means going to their mental health appointments, going to their medication appointments, seeing their primary care physician, and other such responsibilities, such as sometimes it's seeing their parole officer or going to the community corrections office. And we often, with these issues of transportation, they don't have the transportation, they might miss an appointment, and sometimes this is seen as not adhering to a program or adhering to the services that are offered. And when keeping in mind, some of these areas don't have that public transportation. So that's not an option for them. And if public transportation is an option, sometimes they don't have the funds to be able to ride the public transportation. So we have the issues of not having sufficient funding. We also have the issues of if they live in a rural area, transportation is not that accessible. There might be no public transportation, and sometimes this is when we depend more on maybe a peer support specialist or a case manager that is on the team to help with the person with transportation of that person. And with that, we also have that cost of care. So most times, a person that is either housing insecure, they have that barrier of cost of care to receiving treatments and to finding resources. Most of the time, when they do have the finances available, they typically don't look forward to paying their medication or paying some sort of bill they have to take care of. Most of the time, a person that's housing insecure, they look into using their finances to either pay another night at a hotel, find food, or other such care needs that will keep them going. And then we also have that issue of communication. So that the challenge of accessing care when it comes to communication is not just that of a language barrier, but we often do see that language barrier in many of our communities when with someone that is housing insecure. But we also have to keep in mind of that challenge of communication when it comes to not being able to afford a cell phone. So sometimes a person is not able to communicate adequately or frequently because they can't afford a cell phone. And there are different programs that make it accessible to help a person receive a cell phone, but oftentimes we also see that they either lose this cell phone or it might get stolen depending on their housing situation. So again, that lack of access to a cell phone or lack of access to internet or any other type of access to being able to communicate really does affect a person from being able to access their care adequately. And then the most prevalent one that we see is that challenge of that discrimination and that stigma. And this is highly prevalent in that population that is housing insecure, because more than likely a person that is housing insecure, they do might have issues with the criminal justice system, and they might have some sort of mental health condition. And dealing with all these stereotypes and that stigma and that discrimination, it makes it difficult for them to set attainable goals. And this is attainable goals when it comes to their healthcare, their mental health, their recovery from substance abuse, or long-term goals when it comes to recovery and being able to actually have secure housing. And with these the stigma and that discrimination, we often see it in we see it in the community, we see it in landlords, we often see it with places where a person is trying to find or access that care. And that high probability of that, oftentimes we see a person that is housing insecure, they don't want to go ahead and try to find access to this care because they're also afraid of that stigma and that's discrimination. Also ties back into their mental health condition. You know, this is very overwhelming to them, and they continue on the process of not being able to find that secure housing. And with that, I will turn it over to Isaac. He will be explaining and presenting on what SOAR is.
Thank you. Do I screen share here or you have it perfect?
Yeah, yeah.
Okay. So hi everybody, my name is Isaac Johnson. I'm the Resource Line Director with NAMI Kansas. Today I'm going to be talking about SOAR and how it can work out in Western Kansas. So firstly, what is SOAR? So SOAR is going to be, I'm going to click. There we go. SOAR stands for SSI/SSDI Outreach, Access, and Recovery. It's not a group or organization, but it is a model that is designed to increase access to disability income benefits for individuals who are experiencing or at risk of homelessness. This definition comes from the SOAR Technical Assistance Center, and just so we're all aware, SOAR is run through SAMHSA. Next slide. Okay, so why SOAR? Why should we utilize SOAR and not just have people apply on their own terms? So there's two big reasons here. So the first one is that's going to remove barriers to access. So applying for things like SSI and SSDI can be really challenging for multiple reasons, and a case manager helps remove those obstacles. So for example, a case manager is able to maintain consistent communication. Some people applying for benefits may not have a mailing address, or they have a very inconsistent mailing address. But the case manager does have a consistent mailing address. So maybe the case manager works for a community mental health center. Well, they can get mail sent to their office and they can send mail out from the office as well. The case manager is also able to make timely progress. They're going to be able to better track dates and have a better chance of making deadlines. So compare this to some people who might be applying for benefits. So for example, somebody who is exiting the legal system, like they're currently in jail, somebody who's currently in a hospital, maybe somebody who struggles with executive dysfunction as a result of their disabilities, or maybe somebody who has a hard time remembering or keeping commitments to their life circumstances. So for instance, like a single mother who works 3 jobs and taking care of 2 kids. She may not be able to make SSA appointments or follow through with doctor's offices to get medical records or anything like that. So case manager can't do that though. And then lastly, the case manager is going to be knowledgeable about the process. And so they understand the process and what it entails, and as such, they can provide guidance and reassurance to applicants. And they're going to be better able to do things like collect medical records because of their knowledge of the systems in place. So they're going to know how the application process works, and they're going to know, what like doctors looking for, and so on and so forth. The other big thing here is going to be the medical summary report. So the medical summary report is a letter that a SOAR caseworker writes with in-depth documentation of disability. So generally they're like 6 pages long, and this is going to be a very long narrative just detailing why an applicant is unable to meet substantial gainful activity, often shortened to SGA, due to a disability or multiple disabilities. So this is going to be the key element of SOAR. This is like what makes it important and efficient and effective. And so to understand why the MSR works, we're going to have to talk about the SSA application process. So you can go to the next slide. Perfect. Okay. So when you go to the SSA evaluation process, we see here there's 5 steps in this process. So somebody applies for SSI and or SSDI, and it goes through these steps. At all 5 steps, there is the ability to make a decision about whether or not someone gets those benefits. And then as you see, at 4 of these steps, you can be denied, and at only 2 of them, you can be approved. So you have a very good chance of not getting those benefits. So the goal of SOAR is to intervene at step 3. If you want to click again, yeah, at step 3. So the step 3 is when the disability examiner gets a hold of the application. You get approved the first 2 steps, it goes through. Oh, sorry, the disability examiner is going to look at your application, and then they're going to reach out to all the hospitals and stuff and call for medical records. And from what they've collected, they have to make a decision about whether or not they want to approve you. And so maybe they might schedule an appointment, probably not. But I mean, they're going off of very limited information to make a decision ultimately. And compare this with someone with a SOAR caseworker on their side. So, like if I'm your caseworker, what I do is before I even submit your application, I reach out to all the hospitals, all the, whoever jails you've been involved with, caseworkers, community mental health centers, anything that has, records about your diagnoses. I will collect all those, and then I write this big long letter explaining why your disabilities make it difficult for you to meet that substantial gainful activity. And then I send that off to the disability examiner. And the end result of that is that it firstly lessens the amount of time that the disability examiner has your application, because it is you already have all the medical records there ready for them to read. And also what it does is provide the disability examiner with more information about the applicant's disability. So an applicant may not have total awareness of how they're impaired in certain ways. And so then I'm able to give maybe a more objective picture or a fuller picture. So like an applicant may not think to ask their sister for input about, disability, but I would. So it's like they may not be able to articulate, I have a hard time concentrating, I have a hard time focusing, I have a hard time getting along with people, but I can see that from interacting with them and from interacting with people around them. And then my letter is communicates all that much more efficiently and effectively to the disability examiner. So this brings us to our SOAR outcomes. So what I'm going to do here is I'm going to compare outcomes, so without SOAR and with SOAR. And for the without SOAR, my numbers are coming from an article from this year, March of this year, that pulls information from the SSA office. And with SOAR is going to have outcomes from the SOAR TA Center for last year. If you notice, I say percentage of qualifying initial applications. What I mean by that is that I'm only counting applications that pass the basic eligibility requirements, not the ones that get denied for not meeting basic eligibility. And just for reference sake here, the qualifying applications, if you're applying for SSI and you are a single, you have to make less than $1,913 a month in wages, less than $930 to $4 a month in other sources of income, and less than $2,000 in assets. If you're married, it's less than $2,827 a month in wages, less than $1,391 in other sources of income, and less than $3,000 in assets. If you're applying for SSDI, you have to you can't make more than $1,470 a month if you're sighted, and more than $2,460 a month if you're blind. And you have to have sufficient work credits. So in this case, you have to have at least 10 years worth of work experience, with 5 of those years being within the last decade. Although if you were, too young to have worked for 10 years, they do make exceptions for that. So without SOAR, if you're just to apply normally, you have about a 38% chance of getting approved that first time. On care with a SOAR, it's a 68% chance of approval. Without SOAR, it takes about 227 days for that application to be approved the first time. With SOAR, that drops down to 153 days. Without SOAR, if you apply and get rejected and then you do an appeal, altogether you have about a 48% chance of getting approved. With SOAR, that's going to jump up to 77%. So let's talk Kansas specifically now. This is my next slide. So for initial and appeals, you have about a 70% approval rate for last year. Cumulatively, that's about 65% for initial initial approvals was at 65% in 2022. Cumulatively, you have about 81% chance, and last year it was going to, or cumulatively, excuse me, it's going to be 68%. So 81% for last year versus 68% overall. And then based off of numbers from 10 states, every time someone gets approved for SSI or SSDI, we see about $25,180 reimbursed to Medicaid. And so what we're seeing here is not just people getting access to things like, benefits and healthcare, but also we're putting literally millions of dollars back into local economies. So in addition to that, when people are able to get the access to healthcare they need, it's going to put less strain on the healthcare and legal systems. So, there's less medical debt. And also, if you're able to access like antipsychotic medication, for instance, you're probably less likely to have an episode that ends up with you in jail. And also disability benefits means you have more access to housing and employment benefits, which means you have an increased participation in the economy and less strain on resources around things like housing. So for this next slide, one of the things with SOAR is that we're supposed to be helping people who are currently homeless or at risk of homelessness. So I do want to define what that means in SOAR terms. So the SSA, their definition is much more traditional. So as we kind of previously established, someone with no permanent living arrangement, so they're not part of a household and they're not a resident of an institution like a hospital or a jail. So someone who sleeps out on the streets, to put it very, very simply. Couch surfing also does count under the definition of SSA. So people who are regularly kind of moving households, but they're not a permanent part of that household. SOAR defines it a bit differently. So my next slide is going to be about how SOAR defines it. And it's very much in line with how the Department of Housing and Urban Development defines homelessness. So there's 4 categories here. So again, someone or a family without a fixed, regular, adequate nighttime residence, like someone in a homeless shelter, someone who's going to lose primary nighttime residence within 2 weeks with no housing planned for afterwards and no resources to find that housing. So someone who's about to be evicted from their apartment counts here. Again, this real big chunk about unaccompanied youth or families with children who qualify under other federal statutes. So an example of what this might look like would be like a single mother with a son who's disabled and he really needs to go to a lot of doctor's appointments. He has behavioral problems at school. So she's constantly having to leave work and, pick him up, take him to doctor's appointments. And as a result, she can't keep steady employment. She can't make enough money to make rent and she's moving around like all the time. And then lastly, as we said earlier, an individual or family who is fleeing or attempting to flee domestic violence and has no place to go, no resources to find housing also qualifies as experiencing homelessness here. SOAR is also a bit different because we talk about people who are at risk of homelessness as people who also qualify. So there's 3 factors here. So to qualify as at risk of homelessness, firstly, you have to have an annual income of under 30% of median family income for the area as determined by HUD. So for instance, a family of 4 in Dodge City making under $30,000 a year. Secondly, you have to not have resources or networks to prevent moving to emergency shelter or place not meant for habitation. So for instance, an unemployed man in Marshall County being removed from his home following an arrest. And then the third one is going to be you have to exhibit 1+ risk factors of homelessness. So things like housing instability or exiting publicly funded institution or system. So for instance, a woman who is exiting a prison and has no place to go to afterwards. So SOAR as like the SOAR TA Center, I should say, they've identified multiple special populations, and rural communities is one of the special populations here. So this is for a few reasons. So homelessness looks different in rural communities. So this is going to look like doubling up. So multiple people living in the same household, living with extended family, but not owning that place. And then also living in areas well outside of town where you're pretty far removed from resources. Maybe you live in a pretty rundown place that's not safe or hospitable. Um, Another problem, if you want to click, is there's a lot more challenges in rural areas. So statistically speaking, people in rural areas are much more likely to experience poverty. They have a lack of resources, services, and infrastructure, and they have limited affordable housing, as well as limited community support. And then above all, there's limited access, which means there's more barriers to accessing disability benefits. So for instance, if you are trying to apply for SSI or SSDI, you're probably gonna have to go to the SSA office at some point. Well, maybe you live an hour away from the SSA office. Here in Topeka, I could easily be at the SSA office and back, within like 10 minutes driving out, 10 minutes driving back. But, maybe out in Western Kansas, you have to take off work for 4 hours so you can drive out there, talk with someone, and drive back. And that's obviously going to be challenging for people. So this is where Sora can help. If you go to the next slide. So if you're doing SOAR work out in like rural areas, SOAR TA Center really recommend using telehealth whenever possible. Obviously, we know this is going to be a challenge for some people, but that's one of the beauties of telehealth too, is that you're able to reach out to more people than you might otherwise be able to. So case workers manage application process. So that takes a lot of burden off of the shoulders of people who are applying. They don't have to worry about, calling the SSA office, calling the hospital for records. They can just communicate with you and you can help do a lot of the work with them. And then also SOAR is a benefit to you as a caseworker. It's not like you get trained and then they drop you and say, good luck. Like, no, you're in contact with other caseworkers who are able to give you advice and resources if you need help. So for this next slide, I also wanted to bring up that SOAR has an online library that is accessible to anybody. Because SOAR does not just stop at the application process. It's not like you get approved and that's it, you're done. SOAR also provides resources on what happens after somebody gets benefits. And that's one of the nice things about this library here. The SOAR TA Center is extremely helpful, communicative. I've had to email them multiple times and they always respond very fast and they're very helpful. And this library here will provide information on things like employment, housing, what happens if somebody loses benefits, in addition to any questions you may have about the application process and getting someone enrolled in benefits to begin with. If you get SOAR trained in Kansas, you do get connected to like this big group chat thing that connects you with all the other caseworkers in Kansas that do SOAR. So you can always reach out for questions and people can help you there. And in Kansas, the state lead for SOAR is Jonathan Pendergrass, and he works with KDADS. And if you're wondering about other people in Kansas who do SOAR, if you look on the screenshot, there's a tab, it's the state directory. If you go there, you can find the list of local leads in Kansas and in all the other states in the US. All right, so how do we get involved with SOAR? So firstly, I just want to say SOAR courses are free. And in addition to that, each course, both the adult SOAR course and the child SOAR course, offers 20 CEUs. And that also SOAR courses are self-paced. So you can complete them as you are able to. There's not a time limit either. It's self-paced. And once you finish your practice case, it'll go off to the SOAR TA Center and they will grade it. So if there's any problems with it, they'll send it back to you and just tell you need to redo a part. So you actually do get feedback and you know what you need to work on, what you're doing right. And then as soon as that gets passed through, you are SOAR certified. You get connected with all the other SOAR caseworkers in your state and then by extension the rest of the country. All right, so that's all from me. if you have any questions, feel free to reach out to me or ask me now. I'm happy to talk more about SOAR.
Thank you, Isaac. I appreciate it. And if anyone from the audience has any questions, you go ahead and you put them in the chat box, or you could unmute yourself and ask those questions. Or as Isaac said, his contact information is on the slide, and I will provide this contact information afterwards. So you could always contact him directly.
Okay, so Isaac, I have a couple questions for you.
Yeah.
So I am currently slowly working on the SOAR course. So once I am certified, how do I let people in my community know that I'm certified? Because a lot of people haven't heard of SOAR, so they're not going to know to look at the SOAR website to see who's local. So how do I get that information out there?
Yeah, so again, there's that library, and the library has a bunch of stuff in it. So one of the things the TA Center does too is help people with promoting it and like making sure people are aware that it's a service you provide. So since you're here with NAMI Flint Hills, we could easily have a promotional flyer sent out and saying, hey, we can help people enroll in SSI or SSDI. Another nice thing too is once you are like officially certified, like I said, you're connected with all the other Kansas state workers. And so what happens is someone can message like the group chat or whatever and say, I'm looking for a SOAR caseworker in like Manhattan. And then you can kind of connect with people that way. Or you can connect with other people. Because I know Pawnee Mental Health has some SOAR caseworkers. So you can easily connect with them and you build networks. So that way you can kind of get the word out. And obviously just talking with people. I talk with people all the time about it. It's just like, hey, this is a thing you can do. And sometimes I know about it, sometimes I don't. Sometimes I do know about it and they just don't realize it applies to them. So yeah, just talking, promoting it on like the NAMI Flint Hills page, whatever, what page you might run, keeping in contact with community mental health centers, excuse me, and specific, those are really helpful. They tend to have SOAR caseworkers on their staff.
Okay. And then one other question. Why did you become a SOAR worker, trained in
Yeah, so
SOAR?
it's funny because like basically the opportunity was offered to me and I just took it because I was like I wasn't even sure what it was. I was just like, oh, okay, I'll take it because I don't know that much about SSI or SSDI. I'm really glad I took it. Like because I'm a social work student. I'm getting my master's right now. So I thought this sounds like it'd be relevant to me as a resource line director, but also to me as a social worker. And it definitely is. I extremely highly recommend people do it. Because it gives you a lot of more knowledge about how this stuff works, how the application process works, how the approval process works, how, the benefits themselves work once they are there. And so it makes you, extremely helpful to so many people, especially if you're working with, homeless populations or populations, with mental health conditions or physical conditions. At this job, it's been extremely helpful. I've brought it up with so many people. I've been able to tell them, like, here's what you expect from the process. Here's, what you can get out of applying for this to begin with. Sometimes people don't even apply for it, and I have to like talk them into it and be like, no, it's not going to hurt you to apply for it. Like you can apply for it, and then people can help you. Um, so I just kind of did it on whim. I was like, yeah, I'll do it. I don't know what this is. I'll do it. And I'm glad I did because I got to go to Rhode Island to do the SOAR locally training, and that was fun. I got to meet people from all over the country. Very informative. SOAR TA Center, very nice folks. Again, they're very communicative. I've asked them so many random questions, and they're always very quick to respond.
I just thought of another question. So if someone contacts me and wants help with the application, but they speak another language.
That's a great point. Yes. So that is something else with SOAR. So one of these special populations they have listed is like, I think they technically Spanish speakers, but they also kind of do expand it to like, people who speak English as a second language or maybe not at all. So in that case, I would definitely reach out to either, like the Jonathan Pendergrass and the Kansas group chat that we have. It's not a group chat, it's a base camp server, but I don't know what else to call it, a group chat. Or the SOAR TA Center. They have resources and information about, how to, help people who speak a different language natively, because that is a big population to help here too. Especially as we get more and more Spanish speakers in the country.
Okay. Well, thank you for answering the questions. That's all I have.
Awesome.
Thank you. Isaac, I appreciate your presentation. And if anyone, again, has any questions regarding SOAR, or if you don't have SOAR currently a SOAR member in your staff, and we really do recommend it, please reach out to Isaac. He could provide information if you have any questions, or lead you to the correct place to get more information. So Isaac, thank you for providing us with that information today.
Yeah, thank you.
And continuing on with our presentation, we have, next up we have more information on Kansas housing resources, and again, place this section of the presentation after SOAR, because most of the times it's difficult to find any sort of resource, especially when it comes to housing. And being knowledgeable of finding the SOAR person could help with that, because a SOAR representative will help with finding housing resources and such, and with those applications too. We have so just a few facts on that of the Kansas federal rental assistance. We see typically 58,000 people in 35,000 Kansas households use federal rental assistance to afford modest housing. And 75% of these individuals are seniors, children, or people with disabilities. 25% of that are people assisted or seniors, and that is about 14,600 of those individuals. And we have 27% of 27% of the assisted people, or a person with a disability, some sort of disability. That's 15,400 of these individuals, and 50% of assisted people are in families with children, and that's where we see the biggest number at 29,000 individuals that receive this housing assistance. But we also have to keep in mind that this is very limited funding. So 3 in 10 low-income people in Kansas, which is approximately 147,000, are homeless, or they pay half of their income on rent. And most of these don't receive any federal rent assistance due to that limited funding. With those numbers, we see about 29% of those individuals are children. So that's anyone ranges from age 0 to 18, and 37% are working adults, 13% are seniors, 23% are an individual with some sort of disability, and 4% are veterans. And also, when keeping in mind with these, with the federal rent assistance here in the state, we often see that there is that limited funding, but also we need to keep in mind the wait lists that we see primarily in many of the counties here in the state. And sometimes these long wait lists, they could be several months long. And this includes housing such as Section 8 or any other sort of housing vouchers. We see those wait lists be primarily long, especially in those bigger counties in the state. But with that, we also, in correlation with that, we have that Kansas Continuum of Care. And the Kansas Balance of State Continuum of Care is a community of individuals and providers that organize and deliver housing and services to individuals and families experiencing homelessness. And what we see with the Kansas Continuum of Care, and in this following slide, I have the map. So we have 8 regions of this COC, and this covers 101 counties out of the 105 counties in the state. And this is excluding Shawnee, Johnson, Wyandotte, and Sedgwick counties. And these are divided into 9 different regions, and we typically have one person that is a contact person for each region. And I do have the contact information for each region available. I will be sending out a handout with the resource to this information and other information that's later on in this presentation will be made into a handout, will be sent out so everyone has easy access to that information. And with the continuum of care, it is recommended that you contact your region person in order to receive the best results, or you can contact the main project manager for everything, and they for the continuum of care, and they will give you the contact information depending on your region. But also with information from the Kansas Housing Resources Corporation, we have 2 different grants that we've seen. And we've recently, during COVID times, we had an increase of grant funding to help with housing. And recently, unfortunately, we have seen that some of those sources have closed off, or they're getting ready to be closed off. They're no longer offering that financial assistance. But under the Kansas Housing Resources Corporation, there are 2 main grants that are still offered. First of all, we have this Community Services Block Grant, or the CSBG. And the Community Services Block Grant, this provides critical funding to community action agencies to operate programs addressing the causes and conditions of poverty. These agencies aim to reduce poverty, revitalizing low-income communities, and empower low-income families and individuals to become fully self-sufficient. And in this following slide, I have the map. We have 8 regions for these entities, and so the CSBG, it works through the 8 local eligible entities in Kansas to support these services and or activities for individuals with low incomes that most of the time that it helps with those causes and conditions of poverty that they might face in their community. And again, here in this slide, I included that contact information, but I will be sending out this contact information later on. And this grant, they do have some funding, unfortunately, as we've seen in many of our areas. It might not be sufficient funding for many participants in different programs such as AOT or in general with our community, but each of these 8 regions do receive some of this funding from the CSBG to help with alleviate those uh, negative impacts that they often see when it comes to poverty. And the other grant that is more commonly used throughout different community mental health centers and different services in the community, we have that emergency solutions grant. And again, unfortunately, limited funding makes it difficult to be able to help many individuals. But with the emergency solutions grant, or the ESG, this provides funding to a network of service providers who assist Kansans experiencing homelessness or at risk of becoming homeless. And the list of providers will be sent out in that handout. But as I mentioned previously in the presentation, when a person is category 3 homeless, they do qualify most of the time for the emergency solutions grant, if funding is there. And again, an individual that is in category 3, this is a person that is completely homeless. They are unhoused, and they need some sort of help to receive that. And right now, according to the Kansas Housing Resources Corporation, this is a primary resource that's available for any individual that is truly houseless, homeless. They are having to live in that transitional housing, such as a shelter, or if they have the funds, a motel, or oftentimes, as what we see as a person that is couch surfing, is often a person that is out here looking for funds and able to find housing for themselves. And most of the time, this funding is to help homeless individuals and families improve the number and quality of emergency shelters and supportive operation of shelters. It provides essential services to shelter residents, rapidly rehouse homeless individuals and families, and prevent homelessness. So with the Emergency Solutions Grant, it is a grant that tries to do its with this grant money, they try to do the best that they can with shelters and other organizations in different communities, and then also with those individuals that are unhoused. And with in Kansas, we do have those increasing numbers of the homeless population, and we have seen those increase in many other communities. We've seen the increase in cost of living, cost of rent, and there's not a lot of resources, unfortunately, to help. But we do have, and we are able to provide. I will send out that resource list that includes the contact information for the continuum of care providers that in the different regions that help. We do have. I reached out to the Kansas HUD office, and they sent me over a list of resources, typically. So it's in their list, they have the link, so you're able to access either a website or contact information for someone that could help. So I will also be emailing out that contact information. I didn't want to just list it on a PowerPoint, make it more difficult to write down information. We also have that list of the Emergency Solutions Grant providers. And we, upon some research, we have found other resources in the state that help with housing and home owning loans. And the Kansas Housing Corporation, Resources Corporation, they also offer a loan that's regarding rural areas and helping with first-time homeowners, and in these rural areas, it is areas that have less than 10,000 individuals in their county, and there's information on that. And they also offer assistance with weatherization of houses. And again, the funding to these different sources unfortunately are limited, and some of these are more difficult to apply to and to get. But right now, the CSBG and a grant and this Emergency Solutions Grant is really what we have right now to offer in the state to our individuals that might be facing some sort of housing insecurity. And I know in many of we've faced in our AOT counties, we are facing that problem of many individuals being housing insecure. So hopefully with the resources provided, we're able to kind of create that network of communication, hopefully being able to find more resources for any individuals that need them. And with that, that is the end of our presentation. I know it's shorter than we normally have it, but we had a shift in our agenda. And so if anyone has any questions, again, you could unmute yourself and ask your question, or you could also contact me via email, or contact your local NAMI AOT specialist with any questions. So the NAMI AOT team, we do have these resources available, and I will be sending it out to everyone is on that emailing list. And if you receive this information, please feel free to share it out with your case managers, your peer specialists, with any other individuals that might help with housing in your community mental health center or in your community in general. We're trying our best to spread information when it comes to housing resources, because it's definitely something that we are struggling with, and hopefully we're able to do more as a state to help with that. And I appreciate you all for logging in today. And you will see more information in the future regarding our next educational sessions.